for this week's lecture, Life in Utero. Don't worry, I'm not gonna repeat the lecture. It has been posted since a week ago, or maybe more than a week ago, and this lecture was divided into 3 videos for better viewing and probably easier comprehension. So I will share with you the slides I prepared for this afternoon. Okay. So if I did my homework right, there should only be one screen for you to see. Yes? Anyone, please?
One screen.
Yes, Padok.
Okay, thank you. So as I said, uh, this week's lecture is Life in Utero. I'm Dr. Maria Cristina Cruz, and the objectives for this lecture are to discuss the 3 periods of intrauterine life, to identify crucial periods during intrauterine development and their clinical significance, to present the significance of the placenta as a fetal maternal organ, and to introduce the concept of fetal behavior and programming. So let me reiterate the stages of intrauterine life. We have the germinal period, which is the first and shortest stage. We have the period of the embryo, which is the period of organogenesis, and the period of the fetus, which is for growth and maturation of fetal organs. Because it is the period of organogenesis, it was mentioned that it is during the period of the embryo that there is maximum sensitivity to teratogens. Broadly defined, a teratogen is a substance that causes physical or functional abnormalities in a human embryo or fetus when they are exposed during intrauterine life. Exposure to teratogens would increase the risk of abortion or a miscarriage. It increases the risks for premature birth or a stillborn or death in utero for the fetus. Teratogens may be in the following forms. So we can have alcohol is a teratogen, smoking and nicotine is a form of teratogen, recreational drugs like marijuana that can be considered a teratogen, and then infections is also considered a teratogen, and environmental toxins like mercury, probably lead, and others, those are also considered teratogens. For the infections, the most prominent is the torch syndrome affecting intrauterine life, especially during organogenesis, and it is responsible for about 2 to 3% of congenital abnormalities. So torch, T stands for toxoplasmosis. O would stand for other infections like syphilis, varicella zoster, and parvovirus. Then we have R or rubella, or it's more commonly known as German measles, C or cytomegalovirus, and H for herpes. Beginning the 21st century, new viruses developed, causing infections and emerging diseases. This diagram shows the different types of coronavirus in recent years. So it's just limited to coronavirus. And the diagram illustrates zoonotic transmission, meaning the virus originally came from an animal, transferred to another animal, and then finally to humans. So in 2003, there was the SARS-CoV, the original SARS-CoV, which started in China and spread to 4 other countries. This was from bats to the civet cats and then to humans. We also have the Middle Eastern respiratory syndrome caused by the MERS-CoV, which started in Saudi Arabia in 2012. So this one affected camels, and from the camels, it affected the humans. Then, of course, the last few years, we have SARS-CoV-2, wherein they said it started from pangolins or bats or the other way around, then affecting bats and pangolins and then humans. So this is just coronavirus. Other viruses that came to, that was, how would you say this, that had caused a stir the past years was, I think there was the monkeypox, okay, monkeypox, which is not a form of coronavirus. It resembled more the smallpox virus, but not as lethal. In a review by Dr. Yu and his associates, they tried to see if viral infections during pregnancy was a threat to both maternal and fetal health. They even posed the challenge that maybe this will be the future, this is the future big challenge to maternal and fetal health. So also from this same article by Dr. Yu and his associates, they found out that these viral infections during pregnancy would cause these maternal and fetal outcomes. It can cause maternal death, it can cause pregnancy loss, it can cause preterm birth, it can cause gestational diabetes and preeclampsia. As for the fetal and neonatal complications, it causes intrauterine growth restriction. It can cause a baby to be stillborn, or if he is born alive, within the neonatal period, the baby dies. Then there is microcephaly, hearing loss, and other disorders. Long-term health issues would include cognitive impairment for the child when he or she grows up. They may exhibit compromised immune system and develop diabetes even in the later years or in adulthood, hyperglycemia, obesity, and so forth. Now, for the past 3 years or so, the specter of COVID-19 has affected the world. And what do you think is the effect of on intrauterine life of the SARS-CoV-2? So we try to look for data pertinent to this. And the first data I will show you is from the US CDC. And this is covering a period of 30 months from January 2020 to July 2022. They had a total number of over 225,000 pregnant women who had COVID-19. Unfortunately, they also had deaths, and they were about a little more than 300. So what about Philippine data during this time? Compared to the CDC data showed earlier, this is on a smaller scale. But I also want to impress on the students that we too had our share of COVID-19 positive pregnant mothers. So this data covered about, I think it's 16 months from March 2020 to August of 2021. And data was obtained from 4 COVID referral hospitals. The ones in Metro Manila or in the National Capital Region were PGH, Rizal Medical Center, East Avenue Medical Center, and one in the Visayas, the Vicente Soto Memorial Medical Center. For year 2020, starting March, they had 759 COVID positive pregnant mothers. And for the year 2021, it was 909 to total 1,668 from these four hospitals. So to complete the Philippine picture of COVID-19 positive pregnant patients, in terms of disease presentation, 61% of the pregnant patients were asymptomatic, 27% exhibited mild symptoms, 5% had moderate disease, and 4% were severe, and 3% critical disease. Unfortunately, there were also mortalities. There were also mortalities, 17 in 2020 and 68 in 2021. So total 85 for those 16 months over those four referring hospitals. From the CDC and Philippine data, this was the effect of COVID-19 on infants born from COVID-19 positive mothers. There is prematurity because COVID-19 pregnant patients have increased risk of severe disease. The stress of disease may cause the infants to be born prematurely, some even stillborn. Then there is SGA, or small for gestational age. As I mentioned in the lecture, the average Filipino birth weight would be 3,000 grams. For you to be considered small for gestational age, it would be less than 2,500 grams birth weight. Then, the babies would be born in respiratory distress. And there is an increased risk of infants from COVID-19 positive mothers to be cared for at the neonatal intensive care unit or the NICU. Was there also vertical transmission? When we say vertical transmission, it is from the mother who is pregnant, and then the infection is passed on to the fetus in utero through the placenta. So was there vertical transmission of COVID-19? Systematic review and meta-analysis published in the American Journal of Obstetrics and Gynecology showed that there is the possibility of vertical transmission. The rate of infection is similar to other pathogens that cause congenital infection. So that is about approximately 3%. There is, however, paucity of data to show if there is a vertical transmission if the mother was COVID positive during the first trimester. The last virus epidemic that affected intrauterine life that was reported by the WHO or verified was the Zika virus. The Zika virus was actually isolated in 1947, and it is named after the Zika forest in Uganda, where it was isolated. It is transmitted by the Aedes mosquitoes. This is the same vector of the dengue and chikungunya viruses. And most people infected with the Zika virus do not develop symptoms. They do not exhibit symptoms, And if they do, the symptoms are non-specific, like fever, rash, there may be muscle and joint pains, general body malaise, and headache. And these symptoms would last for 2 to 7 days. The Zika virus infection is associated with Guillain-Barré syndrome, with neuropathy and myelitis. So, although it was isolated in 1947, the Zika virus would affect different countries intermittently. It was declared by the WHO as a public health emergency in February of 2016, when Zika affected several countries in the Americas, the most prominent of which was Brazil. This video was published in YouTube in 2018. I downloaded it and edited to show you how the Zika virus affected intrauterine life and how the children affected are progressing. This is just a short video. Please, I hope you can watch it. Okay.
A year ago this month, the Brazilian government declared an end to the Zika epidemic. But there's a legacy of the outbreak that's only beginning to come to light. Thousands of children born with congenital Zika syndrome, a previously unknown collection of birth defects.
Em janeiro de 2015 eu estava grávida e não sabia. E em fevereiro peguei a Zika. Todos os médicos sabiam que iam morrer antes do tempo. Antes de 2 anos, antes de 1 ano, eles morreriam.
Jacqueline Vieira's son, Daniel, is now 2.5 years old. He hasn't developed the ability to swallow, and he has frequent seizures. But he's gotten better, more responsive and able to control his muscle.
Então, assim, até hoje, quando ele fez o último exame do LCR, ele mostrou que ainda tem vírus ativo no cérebro dele.
When Daniel was born, Jacqueline quit her job to devote all her time to him. He gets special treatment at a nonprofit multiple times a week.
Daniel, ele faz físio, fono e terapia ocupacional e psicólogo.
What do your doctors tell you now about Daniel and his prospects for the future?
Depende do profissional. Tem profissional que diz que teu filho não vai evoluir, mas tem uns que diz que ele vai evoluir.
Daniel is one of about 3,000 children in Brazil with congenital Zika syndrome, the neurological disorder that affects children whose mothers contracted Zika during pregnancy. Most of them are here in the Northeast, a hot region with plentiful standing water and inadequate infrastructure, the kind of place where mosquito-borne diseases spread quickly. This is where the Zika outbreak started in 2015, and it's where doctors first noticed the virus was connected to a sudden wave of babies born with microcephaly. That turned out to be only one of many symptoms.
Criança que tem comprometimento neurológico grave, ela tem espectro de complicações, né, que vai desde uma criança que tem comprometimento motor, comprometimento visual, comprometimento auditivo, que é menos frequente, né, e de artrogripose, que são malformações dos membros. E um outro grande problema em relação à síndrome congênita do Zika vírus é a epilepsia.
Zika itself has existed for a really long time. Why is congenital Zika syndrome a new thing?
Especificamente aqui no Brasil, 2015, 2016, houve uma mutação que foi capaz de aumentar a virulência, a gravidade e provocar essas alterações intraúteras.
The Altino Ventura Foundation is a free clinic that specializes in eye care and physical therapy. Early in the epidemic, doctors there discovered that babies born with microcephaly also had distinctive scarring on their retinas. That became one way to diagnose congenital Zika syndrome. After helping identify the syndrome, the foundation started coming up with ways to treat it and to continue to study it. Every week, 156 children come in for therapies designed to stimulate their senses and encourage their motor skills.
When they were born, we didn't even know if they were going to survive for 2 years. And I think it's important to mention that we are learning with the disease and that every day is a different day.
Bora lá, cadê a borboletinha? Tá pura borboleta? Levanta a cabeça pra tu ver a borboleta.
Levanta mais, mãe.
Leilani dos Santos has been bringing her daughter to the foundation every week for about a year.
A visão, ela presta mais atenção, ela fixa o olho na pessoa. E a fisioterapia também, ela pega nas coisas, ela olha e quer pegar. Ajudou bastante mesmo.
These families are lucky in the scheme of things. The Altino Ventura Foundation has a waiting list of 100 people, and there aren't many like it in the country. The clinic depends on government funding, but it gets the same amount of money it got before Zika, with no new funds to increase capacity.
Okay, I hope you got that. The question by the journalist, he said that Zika virus is an old virus. As a matter of fact, it was first isolated in 1947. How come there is this thing called Zika virus syndrome? And the doctor answered, her response was that in 2015 and 2016, the virus had a mutation, particularly the ones in Brazil. And with the mutation, it was more virulent and it had more devastating effects. So congenital Zika syndrome is a unique pattern of birth defects and disabilities found among fetuses and babies infected with Zika virus during intrauterine life. I think you observed some of these features in the video. There is severe microcephaly where the skull would have been partially collapsed, like this figure A, the boy. Then there is the decreased brain tissue with a specific pattern of brain damage. Then there will be damage like scarring and pigment changes in the eye. Joints would have limited range of motion, and some would be born with some would be born with club foot, like this infant to the extreme right. Okay, so I made a hypothetical case using what you learned from the lecture. I would like to get your inputs or responses to the question question accompanying this hypothetical case. All you need to do is turn on your mic, identify yourself, and give your response. Okay, so we have a case one. A 28-year-old known smoker since her late teens informs you that she is 2 months pregnant. On her night outs with her co-workers, she can finish 3 bottles of beer. So imagine that you've finished medicine, you're her primary care physician. And as a primary care physician, what advice can you give this 28-year-old?
Drink two beers na lang. Drink 2 beers instead of 3 beers.
Dr.
Come on,
Valentin
guys.
and
I
Dr.
know
Kim, can you call the
Yeah.
names?
Doc,
Go
Yes.
ahead.
hi, good afternoon po. I am Anya Dael. So,
Yeah.
if I were this girl's primary care physician, I would advise her to stop drinking drinking out with her friends, even if she already has been drinking for the past 2 months, to as much
Okay.
as possible prevent different birth defects and the possible fetal alcohol spectrum disorders.
Okay, that's a very good response, Ms. Dael. Thank you for that. Do we have any other responses? No?
Just
Anyone?
wondering, has anybody asked the mother if the baby is wanted or not?
Sorry?
Baka if I was a doctor, I'd ask the mother, do you
If
really
she
want to have
wanted.
this baby? Baka,
It was an unplanned pregnancy.
yeah, and then nagpapalaglag siya or something.
Okay.
She's
There is one in the chat box. But he or she, I cannot quite read what was written in the chat box. Anyone?
oh,
Okay.
brave souls, come forth.
Yes,
Yes, Mr. Siga.
Miss Marasigan, you raised your hand.
Good afternoon, Doc. I think apart from refraining from drinking alcoholic beverages, since it was stated in the case that she's a known smoker since her late teens, we should also advise her smoking cessation, Doc, because it can have complications as well, not only to the fetus but also the mother. Since systemic po yung nagiging effect ng not only nicotine but other chemicals from cigarette smoking po.
Yes, thank you, Miss Marasigan. So in this case, you saw two teratogens, nicotine and alcohol. Okay. Now this is another short video. How would what can alcohol do to a fetus? This is from a UK site, the Fetal Alcohol Spectrum Disorders Awareness site. Before, when we were in medicine, it was just a fetal alcohol syndrome, but now it's a spectrum of disorders. And what happens to the fetus when alcohol is introduced during intrauterine life? Okay.
Let's establish a thing or two about alcohol. The form found in most alcoholic drinks is called ethanol. And like other alcohols, it dissolves easily in both fat and water. As our brain is made largely of fats and water, alcohol crosses easily between the bloodstream and the brain. This is why we feel lightheaded soon after drinking. Alcohol passes in a similar way from a pregnant mother's bloodstream via the placenta into the amniotic fluid that surrounds and protects the fetus. Alcohol is toxic to the fetal body, particularly its brain. As the fetus has not yet developed a fully functional liver, it only has a very limited capacity to break down alcohol. Fetal development involves many delicate processes. The fertilized egg divides to derive stem cells, which develop into the many different cells that make up the body. In a process called cellular migration, these cells move from one place in the embryonic fetus to another. Alcohol both disturbs how individual cells function and affects their migration during fetal development. Furthermore, development of a fetus involves the complex procedure of gene activation. Studies suggest prenatal alcohol exposure can disrupt this process. Alcohol interferes with the way in which fetal brain cells communicate and form connections known as synapses, a function that is critical for the development of the brain. Animal studies have shown that exposure to alcohol causes cells in different parts of the fetal brain to die prematurely. This may be why individuals with more severe FASD show reduced volume in key areas of the brain. Acetaldehyde, a toxic byproduct of the metabolization of alcohol, has both direct and indirect effects on the fetus. It disrupts the transfer of amino acids, glucose, folic acid, zinc, and other nutrients across the placental barrier, depriving the fetus and potentially inhibiting its growth. This may be why babies with FASD can be smaller than average at birth.
So remember, there is no safe amount of alcohol to drink or no safe time to drink alcohol when one is carrying an intrauterine life. These are some of the signs and symptoms of fetal alcohol spectrum disorder. And I grouped it using the 3 domains of development mentioned at the start of the course. So what are the physical effects? There will be low birth weight. There will be poor coordination. They will have a certain fascia or a certain look. There could also have vision or hearing problems and other organ problems. In terms of cognitive development, the children with fetal alcohol spectrum disorder can grow up to have learning disabilities. They have poor memory retention. They can have speech and language delays. And then there's intellectual disability and poor reasoning and judgment skills. The last column indicates affectation of psychosocial development, wherein they can exhibit hyperactive behavior. They can have difficulty with attention, or they can also have sleep and sucking problems. I prepared another case, a hypothetical case as well. So a 32-year-old consults you at the clinic. She is on her 7th month of pregnancy, but cannot perceive her baby's movements. Her abdominal bulge is at the level of the umbilicus, like so. What statement or statements in this history are alarming for you?
Hello po, Doc.
Yes, go ahead.
Aldous
Please
Castro
identify.
po from 1A.
Thank
Uh,
you, Mr. Castro.
if month na po yung pregnancy niya, so malapit na po yung term niya. So there should be movement na po doon
Correct.
sa ano po niya. May nararamdaman na po dapat siyang fetal movements. Yun.
Yes. Okay.
So
As
there could be problems po doon sa baby.
There could be problems with the baby, yes. As I mentioned in the lecture, the mother would first perceive the movement of the fetus at when? 20 weeks, right? So that is what they call quickening in clinical terms. So once once the movement was perceived by the mother, to show that the baby is active and more importantly alive, she should feel the movement up to when she is about to deliver. Also, if you notice, her abdominal bulge is at the level of the umbilicus. So that is also at about 20 weeks, the size of the uterus. So if you notice, it never grew bigger. So it's either the fetus is compromised, or I think in this case, she had a fetal death in utero. So that is what I mean when you would apply what you hopefully learned from the lecture I gave on life in utero. These are some of the cases you would meet inevitably as a primary care physician. You will be meeting a pregnant woman who will be consulting. Okay, so I've talked about the research on the embryo and the fetus, and these research are voluminous and continuing. But what does intrauterine life mean for the mother's development? I think I mentioned that development is a two-way street. It would affect the stage before and even the stage after. And intrauterine life would affect the life of both the fetus and the mother even after it has ended. So obviously, the effect of intrauterine life on the mother is physical changes that she would experience. For starters, the uterine size will increase the uterus to about 300 to 500 times its usual size by the end of intrauterine life or when the baby is about to be born. There will be changes in the skin pigmentation. There will be breast changes and changes in organ systems like the CVS, the GIT, respiratory system, and others. During pregnancy, the two hormones, progesterone and estrogen, would increase in huge amounts. And research has shown that hormonal shifts are associated with brain changes. An example of which is during puberty or during adolescence. Taking this into consideration, do hormonal shifts during pregnancy also affect the mother's brain? Okay. So this is a new field of research, and they found out very interesting things. Pregnancy would induce changes in a mother's brain morphology, specifically a reduction in gray matter in regions linked to social relations, like, for example, the medial frontal cortex, the precuneus, and other areas. And these changes would last for at least 2 years after giving birth. This reduction in gray matter would increase neural efficiency, especially in social cognition, and it enhances the theory of mind. The theory of mind would enable us to sense another person's emotions and perspective. So in mothers, the theory of mind would enable the mother to recognize her infant's mental state. So this can be a factor in mother-infant attachment and the child's social cognitive functions. For this afternoon's presentation, these are the references I used. And I think we're good. Thank you very much for your kind attention. Oh, before I stop sharing, I am doing a favor. Dr. Vladimir Villaseñor asked me the following students. If you see your name on your screen, you are the mentees of Dr. Vladimir Villaseñor. He already wrote to you using the UERM mail, but unfortunately, no one has responded. Please check your UERM mail. Okay? So I will stop sharing. And here we are. Any questions? The floor is open. There is one question here. I would like to ask if a mom is addicted to alcohol and they are suddenly told to stop since it can affect their baby. How do you control if they are on withdrawal, or are they supposed to lessen it gradually? As I mentioned, there is during pregnancy, there is no safe window wherein you can indulge in a little alcohol. There is no safe amount like, oh, it's just 1 glass. No, it would really affect the fetus. As a matter of fact, there are some who suggest that if you're planning to have a baby, even before getting pregnant, you should, if you're, if you're addicted to alcohol, I think you should start changing your habits so that you can be prepared for pregnancy. Any other questions?
Dr. Athena.
Yes, ma'am. Dr. Salazar.
No, there was this study regarding the effect of alcohol, no? They mentioned that 4 bottles of beer, no?
4 bottles.
4 bottles is already considered as a moderate drinker. So you can base it from there, the level of alcohol that you should be avoiding. Because moderate means
Moderate.
yes, moderate is 4 bottles. For Filipinos, I don't know with the foreigners, I don't know.
What is the regular alcohol content per volume of beer, local beer? San Miguel, Pilsen, that's the most popular. I
Yes.
think it's 5 or 7%
I'll
alcohol.
I'll take a look.
How many kinds of beer do you have there?
For light.
For light, 5.
Light,
Yes.
I'll see. 5%.
5%. Okay. Yeah.
Light. That is San Mig Light.
San Mig Light. Okay.
Yeah. Now for another what is this? I cannot see. I cannot read.
Ma'am, it's all
Different
right.
kind of beer.
Yeah, ma'am, it's all right. It's safe to
Okay.
say that really, no amount of alcohol is safe.
Yes, yes.
No amount of alcohol is safe. Okay.
Can I comment?
Yeah.
Yeah. I'm not an expert on rehab, but I think when I was an intern, we treated a case of alcohol in an alcoholic who was having delirium tremens. You know what that is, guys? Parang when you go into withdrawal, you have these hallucinations, and then you start to have high blood, and then you start to have tremors, and you could actually die. So what we did, but this patient was not a pregnant, no? It was a female, pero binigyan namin ng benzodiazepine to kind of stop the delirium tremens. Because I understand, syempre it's bad to give a sedative to a pregnant woman, but I understand if you're going through withdrawal while pregnant and if you're stopping abruptly, you can actually precipitate an abortion if you're going through the stages of alcohol withdrawal. So yeah, so it's not just a simple matter of reducing the intake of alcohol. I think if the patient is really intent on keeping the pregnancy, we should get the services of a detox expert, somebody who is a specialist in the withdrawal, because even withdrawing from alcohol or drugs for that matter, if it's not done properly, baka an abortion might actually take place or the mother might actually die. So, kailangan may rehab involved.
Okay. There is a question here. Good afternoon po, Doc. I have read before that pregnant women are advised to limit their caffeine consumption. If they need to still have coffee po, would it mean they also can't drink much decaffeinated drinks? Thank you po, Doc. I think there's a number one, when you have decaffeinated drink, it's the presumption that it has zero caffeine. But it would be, how would you say this? It would be safe if we would limit your coffee or your caffeine intake during pregnancy. Okay? But not totally stop like alcohol.
You know, they tell us yung mga buntis who drink a lot of Coke. That's why
Coke?
they're eating. Basta ano, caffeinated drinks, Coke, coffee, and then the child is born and the child has, attention deficit disorder. I don't know if that's true, pero I heard somebody tell this to a patient once. Oh, you're drinking too much coffee and you drank
I
too much.
haven't read
Well, that's true.
any study about
It might be baka old vibes still. Sige.
Yeah.
Baka somebody can research that in the future.
There's another comment here. Biochem, the US standard drink is 40 grams of pure alcohol. I remember din po that women must take less alcohol per day than men because they are likely to get intoxicated faster if they ingest higher amounts. What we learned in biochem last sem. Okay, maybe because it was explained in the video. Alcohol travels through fat and water, correct? Maybe women have more fat content. I don't know. If you can see the physique. Are there any more questions or comments?
Well, it says here drinking caffeine during pregnancy can lead to small birth weight babies.
Small birth weight babies. I don't know. My sister drank caffeine while pregnant, and
Yeah.
those
Here's
her
an
my nephews and
NIH.
nieces were not small. Were not small.
200 milligrams of caffeine per day, about 2 cups of coffee, according to the study by Catherine Grants from the NIH Intramural Population Center in JAMA says, 2 cups of coffee, 200 milligrams of coffee a day. Mixed results though. Some of the children born were smaller than expected. I don't know. Pa mga doctors are stereotypically addicted to coffee because of staying up late at the hospital.
Okay,
I don't know.
so no more questions or comments? Okay, at least turn on your cameras, please, so I can see you and we wave goodbye to each other. Thank you for attending this afternoon's class. We'll see you next week. We'll see you next week. Thank you, guys.
Thank you po, Doc.
Thank you po.
Thank you po.
Thank you, Doc.
Thank you po.
Thank you po.
Thank you, Doc.
Thank you, Doc.